Haven't you realized that the same x-rays that you were told to take and the results of which proved that it was normal, but yet you still had the symptoms that you first presented with? So the root causes of your issues were never really dealt with, but yet your x-rays by the radiologist or the radiographer that took them actually said that things were normal. Have you ever wondered why you still have that problem? Now, the answer lies in the interpretation of those x-rays. Now, I'm going to talk to you about, in this video in the caption, on my YouTube channel, about the way God designed us to function and how the spine is so important for us to be able to achieve health from within. And that is why I talked about in my previous video as well about the specificity that is required for us to really achieve proper spinal diagnosis. And I talk about in my previous video the two-step process where I first figure out where the problem is, and then we look at how to fix that problem that we just found in step one. Okay, so today I'm actually going to take you through a case study of a person who had autism. Okay, now I'm not going to declare to you that or lie to you that this adjustment actually healed him from autism. I believe that there are other root causes of autism, and that's something that we do as well, but that doesn't come through the spine. Okay, but we actually were able to see this patient who had autism achieve better speech recognition, better learning disabilities, improvement in his learning abilities, purely from adjusting his upper neck. Okay, and I'm going to show you this 16-year-old patient, precious little boy, right, who actually achieved improved cognition simply by getting his upper neck checked. Okay, so I'm going to take you through his x-rays. This is going to be a really short video. I want to show you the specificity that we apply here so that when you are on the fence about getting chiropractic treatment for your specific medical condition, you would understand that not every x-ray that you have been given a report of or that you've taken because you were just told to take that x-ray actually has its full extent of explanation. That means not everything on the x-ray has been explained to you, because just because it was required by a certain medical professional doesn't mean that he or she would have fully explained to you the measure or the extent of your problem, because not everyone is educated in the same way. Okay, so I'm going to show you how I was able to interpret it in a chiropractic way and figure out, based on scientific principles, based on research, based on biomechanic concepts, that his upper neck was actually choked, and that was actually preventing blood flow to enter into his prefrontal cortex, which obviously where a lot of executive decision making is made and stuff like that. And through a series of adjustments, he was finally able to take part in theater. He was finally able to take part in speech and drama classes and all these kind of things that are wonderful for a parent to hear. Okay, so I'm going to take you through these x-rays, the CT x-rays. And you can see that this boy, having had a major upper neck compression, just from poor posture, being labeled as being diagnosed as autistic. He just never really had a social life, and he really just cooped up all at home. And you can see that in this area, right, this AI-14 shows how much compression there was in his upper neck. And that number 14 is actually pretty big. It's actually 18 millimeters below the normal rate. Okay, and that actually proves that his spinal cord was very compressed. Okay, and this is just looking at his neck from the side view. Okay, and also a good point to note as well that at birth he actually was not latching properly. He was not having a good breastfeeding experience, and his mom was just really very frantic and scared. Okay, now if you look at the bottom image here, can you see that the numbers here, 33.15 versus 31.05, that's actually vastly different. Okay, 2 millimeters or more is actually clinically significant to a chiropractor. And you can see that this open mouth view that we had, right, you can actually take away all this this view here, but you can actually see that because of this asymmetry, can you see the left side, how it's open so wide? and it's so close on the right side, that actually showed that not only is it compressed, okay, or not only has the upper neck sort of tilted forward as denoted by this 14, right? This actually, this wider gap here and this bigger number here actually shows that his whole upper neck spine in that particular segment has actually shifted to the left as well, as denoted by this left, this L letter here. Okay, now, and I'm going to go into the next view here. Okay, this is called the base posterior view, right? Or the nasal horizontal view. And this actually talks about the rotation in the in the upper neck, and where it's supposed to be a 90-degree angle. Okay, I'm just going to zoom in onto this view. Where it was supposed to be 90 degrees, can you see how it's become 92 on the right side and 88 on the left? So why is it not 90-90, but actually 92 on the left, okay, and 88 on the right? So that actually shows me a three-dimensional layer, okay, of misalignment. Okay, now, so just from these four views, okay, this view on the bottom right actually talks about the same stuff. That's why I won't go into it, but you can see that just using these four images, I was able to arrive at a three-dimensional, 3D misalignment of this guy's upper neck. And that is how we adjusted it over a series of probably 6 to 8 appointments over a course of 6 to 8 weeks. All right, because when it comes to adjusting a kid, we want to be able to have the patient carry out activities as per normal and have them heal on their own. That's why chiropractors who adjust some stuff 2 to 3 times a week when it's not too unnecessary, that sadly isn't gonna cut it. Okay, so that's why it's probably not gonna be the best for you if you are getting treated that way. Basically because it's just not as it doesn't allow your body to heal as fast as it could. Okay, so I'm not saying that it is wrong, but it just probably wouldn't emphasize the natural healing abilities of the body. Okay, now the caveat for that is if you are in acute care and you're getting treated a little bit more often, that is totally fine. Or if you are in really bad aggravation of a chronic pain, then seeing the patient a bit more frequently would probably be a little bit more justified. But other than that, allowing the patient to heal more often, I mean, for a longer period of time before the next appointment, is going to be the way to go. Okay, because it's all healing from within, and we need the body to express the healing abilities that are now found again from the adjustment, especially if they have never gone spinal care before. Okay, so this is really a classic case of how we apply specificity, right, using scientific biomechanical principles, and we actually draw lines and arrive at a specific diagnosis. That means we actually go, yeah, there is some spinal cord pressure in the left side of the spinal cord in the brainstem, and that actually can affect certain arteries, and that can reduce cognition by reducing blood flow to the prefrontal cortex. So you can see all these things that we run, or that we educate the parents about. These are all things that we know as scientific facts, and when we apply to the patient and we explain to the patient that way, then certainty is guaranteed, surety is expected, and the patient actually walks away going, now I know that my neck is aligned. And just to give you guys a bit of added information as well, that we actually also used the leg length check, right? We actually did some palpation, which is to check the movement of the bone relative to the one below. And these are different indicators that we use. So we don't just use the x-rays as a one layer sort of checks. The x-ray is probably the most radiographically sound, is probably the most is the best pictorial representation of the misalignment, but we need other indicators to sort of lend credence to what we see on the x-rays as well, right? And this is what we know in scientific evidence as an opposing view or an opposing indicator check. And like I said in the previous video, the two-step process that we figure out any person's spinal issues, use the scope. We start by using the scope, where the misalignment is, before even going to the person's problems. Okay, so now, then again, this is something that we do in the clinic. And if you're sitting there right now and you have some kind of issues, right, and you haven't had your x-rays been interpreted this way by someone like myself who's a chiropractor trained in a specific method, this method, by the way, is an upper cervical chiropractic method. If you haven't had this kind of analysis, I encourage you to take it to someone different. Don't just go to the same doctor or radiologist that interpreted it as normal and then continue to live with problems that you still had from years ago, right? Go to someone different so that they can give you a second or third or fourth opinion so that you can finally arrive at a diagnosis because not every doctor is created equal, okay? All doctors are trained differently, and you want to find someone who actually has the ability to explain, the ability to educate, and the ability to reproduce that same method on you because he has done it for others, okay? All right, so I hope this gives you certainty, and I hope it blesses you. If you like this content, please comment and subscribe, and I would love to be able to spread this to the whole world so that they know exactly what they're missing out when it comes to achieving health from within. All right, bless you, and I'll see you in the next video.